About Dr. Antara once texted, okay, hello, Dr. Atik, I want to join your course, but I don't have that much time in my hand. So what I can do, right? I said, no, it's fine. You can start from now and you have to give your hard work and inshallah you will pass your exam. So she said, yeah, me and my husband both are going to join your course. I said, okay, no problem. Go ahead. Fine. Thank you. So she joined, and once she joined, she started to practice. She started to attend the live classes, started to give the mocks, and she was very hardworking. And like I must say, you have joined. I think before your exam, till your exam, you have joined every classes. Even like just before your exam, right? 1 or 2 days before, you have joined the mock sessions as well. It was very nice. Okay, Dr. Antara, the floor is yours. Share whatever you want to share.
Yes, sir. So firstly, it's very different because I used to hear all these success stories, no, but it's very different to be on this
Yes,
side
yes,
of
yes,
the
yes,
saying
yes.
your
And
story thing.
and it's a very nice feeling, right?
Yes, it is. And given the opportunity to inspire even one person will make it worth. Like,
Yes.
sir, I would like to, start with one thing that I was very skeptical by joining in this institute because I had already uh, gotten into some. I had no guidance actually, and
Hmm.
I had joined some other institutes to be honest, and I
Okay.
was not satisfied. And it is like ঘট জল খেয়েছি আমি মানে I and after this I joined. I actually heard about your course in somebody else and some other hands-on course.
Okay.
And yes, sir. And
That's
but
impressive.
yes, sir. So this itself is a part of success. No, your name is famous in even somebody else's course. So
Okay.
yeah, so sir, then I had inquired about it and I was little bit having doubts, should I join or not?
Hmm.
But once I had joined just exactly on the day when the hybrid workshop started, and I was like amazed. I have not seen any one person, like exactly you said that there is no institute who will ever do this hybrid workshop, showing skills on video. It is really true because there is no institute who is really working hard enough for a student uh, to, for them to pass, to help them pass. And
The thing is,
at,
like, if everyone is sharing their skills into the recordings, then how they're going to do the hands-on course, right? That's a business.
yes, exactly, sir.
And I don't
And
care about the business.
yes, your course is not a business. That is the best thing, sir. And you have the blessings of so many blessings and love of so many students. No, sir. I am telling you, sir, in the near future, your notes will be famous in all over the world. Like we hear, no, this course is famous in Middle East or that part in
Hmm.
Egypt or this. But sir, I'm
Hmm.
telling you, you will be the future of MRCS. That will be.
Let's
And
see. Yeah.
yes, and then after that, so you were very kind and very generous. You understood, sir.
Yeah, 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 it's fine. Yeah, you don't have to
The
say anything
condition.
about that. Go ahead.
And other than that, sir, all the mocks that you did and Ezra ma'am and Tanvi sir, they were so much tailored according to one person. Like for somebody, it is the empathy he is missing. For the other one, it is confidence that he is missing. So it's not general. And with so much patience, all of you explain us things. It's really wonderful. And for the other things that what was that yeah, you focused, you talked with people, you interacted with them so much, like you knew them, how you motivated us throughout that. Dr. Antara, you have to be confident while answering. And the mocks, even it continued late at night. Like for us in India, it will be like 12 o'clock. For Bangladesh, it would be like 12:30, 1 o'clock. But still, everybody has their duties. Everybody has their set of work to do in the morning, the next day, but still you will continue. And especially your videos, sir. They were so crisp and so precise. And like exactly you said that nothing will come out of what I'm saying. Don't overread, don't overdo things. And It was just like that. So this exam that I found is very different from the normal exams that we give in our
Yeah.
country. There is no
Yes.
role, there is
Yes.
no saying too much. You in India, if you enter the room and smile, the examiner will be like, "Oh, he's trying to show off. Why are you
Yes.
doing
Yes.
that?
Why you are smiling? This is an
Why are
exam,
you smiling?
right?
You know
Yeah.
everything. Oh, I will show you how you
Yeah.
know everything." This is very different.
Yes.
We have to smile. Examiners will be smiling, and like you said, I brought Sprite during the exam.
Good. Good.
Helped a lot. Yes, and yes. Other than that, so during the mocks also, all of you, sir, ma'am, sir, and you both emphasized on speaking the keywords that they want to listen. And this is, I noticed the examiners were doing the same thing. They had some, they had a mark sheet, and they would
Yeah.
like wait for me to utter that word. And if I uttered it, they were like, go tick, next question.
Yes. Yes.
And they were very precise. They don't want to hear the story of what happened. They just want it.
Yes.
And sir, it's really surprising. All the questions that you ask, that we studied, it actually the same things they asked. It is not like, I'm not just saying that it was really the same thing in EDH or any other CA esophagus. All the questions which were there, even osteomyelitis, all the questions were exactly what we studied in the notes. And even in the examination station, I was very, so because my station was the first day and first session. So I
Hmm.
remember on the last day, I was everyone was saying it will be such a long 7 days exam. Ezra ma'am was saying that you should keep on asking other candidates what questions came because they're likely to get repeated. And I was getting so worried. What about the first day candidates, first session candidates? What will happen to them? Like,
Hmm.
first day candidates are the luckiest. I'm like,
Yes.
how can it be the luckiest? He's just saying, to soothe us or to not like.
No.
Uh, and sir, and especially in the station of where there was a different station in procedure where a lipoma came. So
Hmm.
for the examination, I was also because I could not figure out that why will they give such a small thing in an examination for such a big marks and all that.
Hmm.
But somehow I did, and you said me that don't worry, you went through the right track.
Hmm.
That is what, yeah. And answer in the phone call station for the potassium correction part. The examiner was actually waiting for me to ask that is there anything else that you want to ask? I said, sir, you have not. Uh, we have not discussed about the potassium correction, and like just like Tanvir sir said that we have to write down each and every point because he'll
Yes.
make us repeat. He did just before cutting the phone. He asked me, tell me, and not like say he was not giving orders like you do this, you do that. He will just in meanwhile talking, he will say, oh, you do this. Okay, now have you gotten this done? Serum electrolytes? No, then again get it repeated. So it was very vague, but still you have to catch points from that. And also regarding Tanvi sir's in some of the mock, I had no, I had forgotten the name of the patient in his mock sessions, and then he told me that I'm very sorry, Antara, that if this happens in your real exam, you will not be allowed to pass. Oh, I had started crying just immediately after the mock sessions, and believe me, sir, in real exam, even if it was a like a normal station, I used to still write down all the points so that I don't forget
Hmm.
the name, and it helped a lot. And other than that, regarding the angry wife station, she was, of course, very angry, and you had told us to, let her do the talking.
Yeah.
So yes, so I was very empathetic to her. Offered her water, like you said, you should give her tissue papers and all that. So that was, I think, that went well, and. And sir, regarding the somebody in previous success stories, she had mentioned some December candidate. It's like all the stations will be birth. death, and then rebirth. So if even if one station went wrong, you just have to forget everything about it
Yes.
and then just move on to the other station. For the lipoma station, I was so confused that the abdomen is normal, then why and how? And then when I exited the station, all I got to know, oh shit, it was a multiple lipomas, and I did not do anything like that. But and I immediately texted you, Atik sir, tell us I did this. Then you said, don't worry, you went through the right track, it will be fine and all that. So you were always there to support us, sir. Uh, that is no doubt about it. And just I will just make it very quick because it's this thing has been going for very long. I just want to tell to the my future friends and that this we should not underestimate this examination, and that knowledge and skills are both equally important, because we should not especially underestimate knowledge. I Along with the skills part, you should definitely have a partner with you. If not, ask any random stranger and participate in Sanika ma'am's mocks. Please, everyone, do participate because she is amazing, and you also get a different confidence when you practice with strangers, especially when your name gets called out and you have to talk in front of so many people whom you cannot see. So it's a different experience, and it gives you a lot of confidence as well. And she is very helpful, and this entire IMG family is very, very helpful. Like any doubt you ask, somebody or the other will definitely try to clarify and add more points to it. I am really grateful that I joined this institute, that even though I joined very late, I regret joining late, but I'm very grateful. I also dragged some of my friends into it. Some people I met long back. So my friend from Tanzania, I asked Atik sir that he wants to join Dr. George. So
Yes,
and
I'm here. Thank
oh,
you very much.
hi George, yes. And
It's so encouraging to hear you.
yes. And for other people, even if you don't like studying, if you're feeling very low, you don't want to do anything, you don't want to study or tired, just keep on listening to Atik sir's videos. Just take them like food. Just listen to them. Doing whatever if you even if you're bathing, you are brushing your teeth, whatever it is that you're doing throughout the day, even if you listen to his words, it will be like somehow it will stick in your mind, and you will unconsciously, subconsciously will also utter the same words in the exam. So it was a very good experience with you, sir, and I'm very, very, very grateful to have been a part of this academy. That's
Thank
all.
you so much. Thank you so much, Dr. Andhra, for sharing your experience. Where is Dr.
He's he's here, sir. He's here.
Hello, sir.
Yeah, what happened? Why you are not speaking?
Yes, sir. It's always a sound. Uh,
So I would think that it's the same feeling you are going to have as Dr.
yes,
Andhra as
I'm
well.
very thankful that I've been part of your institute. The things I would share is like,
You first introduce yourself, otherwise everyone will think Dr. Andhra is speaking.
I'm Dr. Andra's husband, Dr. Nandu. Sir, I want to tell something like, especially during the exam days, like last week, last 2 3 days, last day, you will be very much tensed. But the key thing is be confident. Whatever happens, like the first station went bad, but leave it there and move on to the next. Every station is a rebirth, like Sainika said once. And keep your confidence, whatever it is, like how much you have studied, but keep your confidence, and in every station you enter with a smile. That's all. And regarding other things, this I used to get like real difficulty in getting of the answers in knowledge part. So I would like to tell all candidates that you should practice with strangers, especially. Especially we may think that I know this answer, that it will come, but when we start to practice or tell when we start to tell some strangers, then only we understand. Yeah, it's not coming. I know the answer. It's still in my mind, but it will not come into my tongue. So the thing is, you have to practice, and practice. That's all, Atik sir. I'm very thankful to you.
All right.
I'm very glad.
And it's very fascinating that you both passed with the same attempt and
Yeah,
from the same time as well. It's very, very fascinating to hear for me, and everyone will get motivated from you guys as well. So try to help everyone, whoever sick anytime. Okay, Dr. Antara and Dr. Nandu, and good luck for your future as well. And I'm very, very happy for all of you.
thank you
So
so much.
Okay.
do tell us when you come to Kerala next time. He's from Kerala.
Okay. Inshallah,
Sir,
I
I think
will.
you have a course in April or something in Kerala,
Yeah.
right? Yeah, yes.
I didn't fix yet about the date and the city. Inshallah, I will fix, but I have a wedding to attend in
Yeah,
Kolkata. So inshallah, I will let you know, guys.
yeah,
We
yeah,
would
sure,
love
sir.
to meet you, sir. Yes.
Yes, sir.
Yes,
Sir,
of course.
Atik sir,
Hmm.
hello.
Yes, yes.
Sir, I just want to tell you something about the exam. Uh, in the one station, there was one station with SIADH. Though
Okay.
whatever I could answer, I read from your notes. But I was thinking to tell you before also that
Hmm.
if you can include something more information about SIADH, because in one station they gave us a picture with urine osmolality and blood osmolality and all that with sodium, and they were asking extensively about SIADH. So whatever I could answer in that station was whatever I had studied from your notes. But I think if you can explain that SIADH a little bit more, and if you can add on to the notes with what are the drugs causing SIADH,
Hmm.
and what is it all about, then I think it will be good, because that question came. I thought after giving the exam of telling you
Okay.
about that new thing. And one more thing, they were asking about the OT conditions, ideal conditions for in that osteomyelitis session. They asked me what all are the OT conditions before putting an implant. That was another question. I thought those two were like new stuff. So if you
Okay.
can add on to your notes and the thing.
Yeah, I
So
will
they were.
definitely.
I told many points, but the doctor was that examiner was wanting, and that question I think in my batch everyone he asked. So he told, you have told me everything, all the points, but one point is left. I still don't know what was the point. Uh, he about the state, like how the OT should be. I said about UV light, about the air filters, and about the prophylactic antibiotic and everything. Less personal in the OT. I told all the points, but he said anything else you want to add on, anything else he kept on saying
Okay.
before putting an implant. So if you
Okay.
could look up, I really don't know what is the answer. What was he looking for? But he said all of what you are saying is correct, but one more point is there. That one
Okay.
more point I still don't know.
I will ask from my RCS friend and I will add into the notes.
Yes, sir. Yes, sir.
All
That
right.
was like from my exam thing.
Okay. Thank you for adding
Okay.
that as well.
Thank you. Yeah, thank you, sir. Thank you.
All right.
Sir,
Thank you,
one more
Doctor.
thing. Hello, sir.
Yes, Dr. Nandu.
One more I would like to emphasize is like in initial part, I was like hesitant to take part in, but later,
Hmm.
like in Dr. Sanya's or Dr. Tanvir sir's mock, I
Hmm.
really faced the what is the real struggle. Like I was like I read that part, but it was not coming from my mind. Like then I realized really what is the real thing. So I would tell everyone to take part in mock, whatever time they are preparing. Like if it is just if you started just reading now, take part in mock. It is very
Yes.
important.
Very, very important. Yes. Yes. All right. Thank you, Dr. Antara and Dr. Nandu, for sharing your experience. Thank you so much.